Well, hello, Kentucky, and honored to be with you today. I'm Rocky Adkins, Senior Advisor to Governor Beshear, and today I get to deliver some really good news. Since March 6th of last year, our governor has been out of his office now twice. Today was one of those visits that we took in parts of Kentucky who are really making a difference, bringing innovation and vision, creating jobs of the future. Today, the governor and I traveled to Morehead, Kentucky to join CEO Jonathan Webb, which all of you have probably heard by now, AppHarvest. AppHarvest is a controlled environmental agriculture facility, this technological marvel that is feeding America and creating jobs of the future right here in my home of Eastern Kentucky. It's more rewarding for me that that's the old legislative district that I represented for many years, and to see development happening in that part of the state is really motivating and really something we've been working on for a long time. But to get the governor for his first time to see it in person was something to see as well, to see the innovation, to see the vision of Jonathan Webb and his team, and to really see how we grow the economy of the future and new jobs of the future, the new way of the future for our region and coal communities across Kentucky, especially Eastern Kentucky. AppHarvest is sustainably growing nutritious organic tomatoes and other produce using the most advanced technology available. AppHarvest is redefining how we feed and grow here in a world that continues to grow its population and to feed the world. And the views that we're getting here in Kentucky because of AppHarvest in the Appalachian region is moving as well. They're getting it done right there in Round County in Morehead, Kentucky, and we could not be prouder to have them as a part of Team Kentucky, part of our partners as we grow and build a better future for everyone across the Commonwealth. Governor, I was there just a few months ago when they actually opened up the facility, dedicated the first part of that facility. And now just a few weeks ago, we see AppHarvest selling tomatoes into the market and into the food stores. And I think just this past week or the first part of this week, they actually sold their 1 millionth ton of tomatoes into stores across America. And that's really moving. And I know many of you from our region across Kentucky are excited to see that. Of course, these tomatoes are boxed up. They're sent out of the truckloads across the different stores and vendors that they sell them to. And to see this happening is really exciting for all of Kentucky. And just last week, Jonathan and other company leaders rang the opening bell for AppHarvest's wildly successful debut on the NASDAQ Stock Exchange. And I know all of you that had a chance to see that happening in Kentucky, especially in Eastern Kentucky, is exciting for us here at Team Kentucky and all of Kentucky. In June, Jonathan and some other leaders joined us in Frankfurt as we announced an international agreement with 16 other partners, organizations, including the Dutch government, and established the Agritech Advisory Council to guide the Commonwealth into this growing industry. AppHarvest is connecting the world and bringing opportunities home here to Kentucky. Just a few years ago, 2 years ago, 5 years ago, we would have never thought these types of jobs would be in Kentucky, especially Eastern Kentucky. And now here is that opportunity for us to grow that in the future. Just today, the company announced it's placing 2 additional container farm units at Eastern Kentucky high schools. Jonathan is very, very committed to growing the curriculum in our high schools and in our colleges to train and educate that workforce needed for the future. These additional container farm units at Eastern Kentucky high schools adding to an educational program in place at Round County Senior High School in Morehead, Breathitt County High School in Jackson, and Shelby Valley High School in Pike County, Kentucky. AppHarvest represents new optimism as we emerge from this pandemic, battle-tested and ready to sprint forward. This investment in Morehead, Round County, Kentucky is a $120 million investment. It is an unbelievable facility to see 300 plus jobs in this facility. And the governor and I got to see those really, really young faces that saw hope and see hope and opportunity for the future, to be able to live in our region, a place where I'm from and a place where I live, Eastern Kentucky, to see these types of jobs and this innovation have the chance to grow and do well. One of the largest indoor facilities, a 60-acre facility indoor growing produce, growing tomatoes. The largest LDE lighting system in the world that's placed inside of this facility. And if I could, we have a film from today's visit that I'd like for all of you across Kentucky to see. I think you'll be as amazed by this as we all are to watch this company grow and do well.
Good. Say hello to our governor. How are y'all? Oh my goodness. If I can, I just wanted to thank you for being a part of our future. That's what you're seeing right here. You know, if you go back in time, we had this small economic development project called Toyota, and it changed our future as a state forever. That's what you're a part of right here and right now, and we couldn't be more excited about a reemergence of Eastern Kentucky, but also about Kentucky stepping into the future, about truly leading, about other people chasing us instead of us chasing them. It's got to be really exciting to be a part of that. I just encourage you to keep working hard, be invested in what this is. You're leading this state right here and right now, and I couldn't be more proud. So thank you all again. Thanks, folks.
Well, you all could see from the film the really amazing facility, and that was only a glimpse of the actual inside of this huge facility that's doing unbelievable work. Our next stop was at a company called Regent Corporation, also in Morehead, Round County, Kentucky, a wireless communication company that has been in Morehead now for a few years, hiring the graduates coming out of the Space Science Center at Morehead State University and building bright futures in Eastern Kentucky as well. The emerging companies that the governor talks about a lot, the emerging companies that are providing the new jobs, the new economy of the future, to help rebuild the economies of coal communities, as I've said, across Kentucky, is moving. And to meet with Bob Scana and listen to him talk about his company. And if you watch the Super Bowl the other night and on the NFL sidelines, the actual radio communication device on the coaches that you could see that was providing the communications through the ear sets were actually Regent communication devices that were built by Morehead State University graduates. And that's just some things that are going on that are really amazing that people really don't know about. And Regent is looking to grow their jobs and their opportunities for our students for the new economy that's going on now throughout Kentucky, but especially concentrating on Eastern Kentucky and rural parts of Kentucky. Our third stop of the day was at another agri-tech business. One of the top agendas and priorities of the governor and our administration is agri-tech. We see this as part of the new economy and is the new economy. We stopped at Kentucky Fresh Harvest. They're pursuing a vision not just for itself, but for its partners and the community there in Lincoln County. This facility is another facility that I was able to visit as the governor was in quarantine part of this and doing everything he could to make sure that practicing what we have been preaching to stay safe and to keep our residents safe. I was able to attend this. And, you know, for today's event, Governor, to see the social distancing, to see these places that we went practicing exactly what they need to be to keep the spread of the virus from happening was really moving to see the respect for that. But this tour we took in Stamford today at Kentucky Fresh Harvest and to see the future of agriculture and jobs in the Commonwealth. Kentucky Fresh Harvest is a high-tech greenhouse operation on a 30-acre campus here in Lincoln County, where Kentuckians right now are working to produce 5 varieties of cherry tomatoes. Kentucky Fresh Harvest seeded its first crop last April. In October, I was there, as I said, to help celebrate the ribbon cutting on behalf of the governor. As late as 2020, the company had filled 37 positions with plans to continue adding staff into 2021. And all the growers there are Kentucky natives. This company is showing the kind of Team Kentucky spirit we're seeing more and more within our emerging businesses here in Kentucky. I want to congratulate the team we met with there today as they grow this $30 million facility into 78 to 80 jobs over the next few months. There was one lady in particular that I want to mention by the name of Carol Hill, who is from Lincoln County, Stanford, who has made her commitment to that county that she wants to invest in that county, to create jobs in that community, to make sure that people that live in that community have a job and have a future. And to be with her during the ribbon cutting and to be with her and the governor today, to see her passion for that community and the opportunity for that community to grow in those types of jobs was really moving for us to see today. And to Carol Hill and the entire team, congratulations to you on your good work, for your enthusiasm, for your commitment to that community. As it stated, the mission is to empower rural communities with advanced agriculture science and technology to build more resilient, equitable food system and bring the future of farming to the Commonwealth. That's the kind of bold leadership we need now, and the governor is focusing on fostering these jobs of tomorrow into the industries of the future. Kentucky Fresh Harvest is training staff for what's known as Equitable Food Initiative certification, which is based on safety, environmental, and social standards. KFH it also is a member of the Appalachian Proud program, and we are all very proud of this innovative company. This is an emerging reality brought about through the vision and entrepreneurs of that whole team there at Kentucky Fresh Harvest. So today was an unbelievable visit. It was a look at the future and what is going on in Kentucky with innovation. And the last thing that I've been asked to touch on is something the Lieutenant Governor has been touching on, and that is the Kentucky Broadband Initiative. The governor's administration, our administration, is committed to provide broadband internet connectivity to every part of Kentucky. Closing the digital divide is critical for economic development, as Jonathan Webb mentioned today. The interconnect to help with education, creating jobs of the future right here in Kentucky. 3 weeks into the speed test, I'm able to report that 52,803 households have participated so far. To give you an idea, in our first week, we have just about outpaced other states that began their speed test 6 months ago. The counties with the highest participation rate so far are Caldwell, Scott, Harlan, and Hancock counties. On the opposite end of the spectrum, we need you to help us spread the word in Jefferson, McCreary, Boone, and Meade counties. I'm glad to see Elliott County is not there anymore. Thank you, Elliott County. We need everyone, no matter where you're from, to participate. The speed test is the first step to bringing internet connectivity to every Kentuckian. It takes about 30 seconds, and it is completely anonymous. We will take this data and build a map which will be critical for Kentucky in highlighting areas most in need of broadband. And we need this map to be able to implement broadband across Kentucky to guarantee this connectivity. Once the mapping is complete, we will work with partners, both public and private, to bring fast, reliable internet connectivity to the areas most in need. Visit speedtest.kentucky.gov to take the test. One more time, visit speedtest.kentucky.gov to take the test. Governor, it was good to be out with you today. It was good to be visiting parts of Kentucky and seeing the great innovation and the great vision taking place in Kentucky. And with that, today, we'll only build on that in the future. Governor, with that, I will yield to you. And thank you for allowing me to give the good news update today. Thank you.
And thank you to Rocky for his great leadership, for being an amazing part of Team Kentucky. We talked as we were traveling today. We are so careful, or try to be, in the governor's office. We had everybody tested who was traveling. within a day or so of traveling, wear our masks the entire time. What was really impressive are those that we visited, how they were enforcing, how thoughtful they had been on the COVID rules. And as I looked around those facilities and even some of the leadership at Kentucky Fresh Harvest, the ladies who put together the rules and how they took pride in how they had rolled those out in their facility, I can tell you exactly why we have had 4 weeks straight of decrease in cases. I saw it in the leadership of the people that were there. So you'll see when we get into today's report, this week thus far is trending a little lower than last week. There's still a lot of the week to go, and it's fairly close, but y'all are doing this. Y'all are doing this. We are seeing really good compliance out there. Keep it up. You know, right now you're showing that we can win. We can decrease cases just through our behavior, and this is at the same time that we're vaccinating. So all that's good. Let's talk about something that's not, and that's the ice storm that is going to come in, especially starting on Thursday of this week. So the Commonwealth is facing a significant ice and snow event starting tomorrow that will last until Thursday night. The storm is going to affect the entire state. The National Weather Service has placed high confidence levels of ice and snow accumulation during this period. The State Emergency Operations Center will be active on Wednesday and remain open throughout this event. On Wednesday morning and afternoon, ice accumulations of 0.15 inches will extend generally north of the Cumberland Parkway. Wednesday evening through Thursday morning will bring 0.10 to 0.25 inches of ice accumulation, heaviest between the Bluegrass Parkway and the Cumberland Parkway. As I go, you can go ahead and move to the next slide, which will give people an overview. Thursday will bring additional snowfall of 1 to 2 inches north of the Bluegrass Parkway and additional ice accumulation. We can expect some scattered power outages throughout the impacted areas due to ice accumulation and the added weight of snow on tree limbs and power lines. The winter storm will not have the far-reaching effects of the 2009 ice storm, thank goodness. However, this is a dangerous weather system, and we urge you to review your family emergency plan and check on the welfare of your neighbors and your friends. We've also placed our National Guard and other state agencies on alert to respond to emergencies. In other words, the National Weather Service is telling us this is for real, and they have a high degree of confidence that Thursday is going to be pretty rough starting on Wednesday night, and we need to be prepared to deal with it. We need everybody out there to make sure that you are safe in the decisions that you make on Thursday, and we suggest you restrict travel, particularly on the interstate system. And this last one hurts a little bit, but this is Mother Nature, and we don't want people to get harmed coming to get vaccinated in certain sites. So due to an abundance of caution, but also the high degree of confidence the National Weather Service is placing on this being a pretty rough weather event, we've decided to close the Kroger regional vaccine sites on Thursday in Lexington, Bowling Green, and Covington. I know if you have an appointment, you're muttering some words right now that I can't repeat, but those appointments are going to be rescheduled by Kroger representatives. We've asked to try to get them in as long as weather permits, as many of them potentially on Saturday with ones they can add on. At the worst, it can be absorbed next week. At the latest, that Thursday, Friday, Saturday. If you have waited a long time to get this appointment, I'm really sorry. But I also don't want to put you out on the roads with thick amounts of ice when, if you wear your mask and you're careful for this next week, we will get you vaccinated. Mother Nature stepped in. She's thrown us a curveball. We got to deal with it, and we are going to. We've already shown that we can vaccinate way more people in a week than we get doses. So the worst that happens is next week, we blow it out of the water and we vaccinate significantly more people with anything that has to ultimately bleed over into next week. But we want you to be safe and we want you to be careful. And so we have to try to set an example. And I got to tell you, I've gotten to see and meet all of these volunteers or employees that are out at these sites. if the weather is what we think it's going to be, we can't have them out on the roads because we need their help vaccinating us the entire rest of this pandemic. So everybody prepare, everybody stay safe. If we're dealing with the pandemic, we should be able to prepare for a couple days of ice and nastiness. Be safe. All right, today's COVID report is a lot of what we've seen and been seeing. It is lower numbers of cases, still death that is too high, though thankfully today is not as high as some others. So today we're reporting 2,339 new cases of COVID-19. That's the least amount, at least it's less than last week and the week before. It's a little bit more than 3 weeks ago, but that week ended up being larger on Monday when we were much smaller. So we are trending below all of those weeks at the moment. Our hospitalizations, ICU, and ventilator numbers, they're up some. That happens almost every Tuesday. We think it's people recounting and updating their numbers in the system. Hospitalized is up about 41, ICU's up 8, ventilator is up 6, but these are normal variations we see week to week. I still feel pretty good about where all of these numbers are. Our positivity rate fell again, 7.66%. That is a good thing. In new cases by county, we just have 3 counties over 100. Jefferson, 396, Fayette, 116, Kenton, 115. Now, Boone County is close at 92. That's why we're so excited to get this extra regional vaccination center open in northern Kentucky. It's just going to take us an extra day because of what the weather is going to look like. And we're carefully watching what Friday will be. We think it's still a little too early to be definitive on what Friday's weather will look like. And we want to do everything we can to keep these sites open. But when we do, we have to ensure that everybody can get there because we don't want to waste one single dose whatsoever. We've got a good track record there. We don't want to change that now. New deaths today, 35. That is still far too many Kentuckians. We don't want to be losing this number of Kentuckians on any day. 16 of them today are from Jefferson County, all of which occurred in January and February. So we'll start with an 89-year-old man from Barron County and a 91-year-old man from Barron County, an 88-year-old man from Boone, and a 92-year-old man from Boone, 97-year-old woman from Boyle, 84-year-old man from Breckenridge, 57-year-old man from Fayette, 72-year-old man from Graves, 2 women from Hardin, 75 and 89, and 2 men ages 67 and 70. 68-year-old woman from Hopkins and a 75-year-old man from Hopkins. 16 individuals from Jefferson County, women ages 58, 65, 70, 74, 75, 76, 77, 87, 92, and 94, and men age 74, 75, 76, 77, 86, and 93. We're certainly thinking about Jefferson County today, while we know that these occurred over, well, when we look at them, less than the last month. That's really hard. And I know it hits that entire Jefferson County community, Louisville community, in a tough way. 95-year-old woman from Kenton County, 76-year-old woman from LaRue, 68-year-old man from Nelson, and 2 individuals from Washington County, a 102-year-old woman and a 61-year-old man. Based on again, looking at these, the percentages of long-term care residents that are passing away are decreasing. And so I do believe that if we can keep up our good practices, we can continue the decline in our cases, we can continue vaccinating, especially those 70 and older and in long-term care, we will see these numbers significantly reduce in our near future. And I know we're all wanting to see that. The death toll has been really hard, really hard. All right, today we have a memorial for Mary Ann Lee Snowden. Today we honor Mary Ann Lee Snowden from Walton, Kentucky, who passed away Thursday, January 14, at St. Elizabeth Medical Center in Florence from complications due to COVID-19. Mary Ann was only 29 years old. Mary Ann's parents, Sherry and Herb Snowden, described her life as an epitome of love that radiated into everything she did. She had quite the knack for remembering birthdays, calling each of her friends and family members to sing happy birthday and make their day extra special. She was actively involved in North Key Community Care in Williamstown, where she loved working in the greenhouse as a florist. Mary Ann also got a lot of joy from her time participating in the Special Olympics, where she loved cheerleading, running track, bowling, and playing softball, multi-sport athlete. She loved anything Disney and was a huge Cincinnati Bengals and Miami Dolphins fan. Mary Ann was sick for 11 days before she passed, begging to go home every day. Her mom stressed, "If you don't think COVID is bad, it's worse than you think. My daughter passed away from it, gone almost 4 weeks, and I don't know what to do with myself. Send prayers, wear your masks, and keep your distance." To the Snowdens, we are so sorry for your loss, but I know a loss for your surrounding community, Mary Ann's community, the Special Olympics community. I know she was a ray of light in your lives and in everybody's life who got to know her. We will do better. We will do better, and we are so sorry for your loss. We are thinking about you today, and there's a flag planted right outside my office, just like the other almost 4,200 plus that we've lost, specifically for her. Long-term care facility update. Again, these numbers are generally better than what we've seen in a while. 14 new residents testing positive, 15 new staff, 12 new deaths attributable to long-term care residents. All right, so let's finally give a little bit of good news that I just learned of today, and that's the federal government is increasing our supply for the third time over the last 3 or so weeks. The White House announced that we are going to get 6% more next week. That is on top of the previous increases, and will have us up 28% over what we were previously getting since this new administration came on board. That means next week we are set to get 71,675 doses, and that compares with, 3 weeks ago, 56,175. It's not enough, but it's great. It's great to get 28% more in the last 3 weeks. And I wish we had 200,000 doses a week right now. We could allocate all of it. I mean, we could get all of this in people's arms, but what I see here are people trying to increase the amount. Just having 15,000 more doses than we did 2 or 3 weeks ago is a real positive, and will mean 15,000 more people will be getting vaccinated every single week. A couple other things. The White House has announced a new vaccination program involving federally qualified health centers to help with equitable distribution. Next week, they're going to start sending some doses directly there. We are awaiting more word on that project. These are groups that we were also in talks to work with. Finally, the CDC is going to issue guidance on helping states navigate issues related to second dose inventory management. So when we show you our updates, which we do each week, right now we're focused on first dose allocation. And it's because what the CDC tells us is we need to do that as quickly as we can. That's why we have our 90% goal. With the second dose, they say the number one thing you should be worried about is getting it to that individual that it's meant for, even if it takes you a little bit more time. But what they are going to give us is what we should do when people don't show up for their second dose after 42 days. That's after that period of time you would normally want to give it. So we are waiting on seeing that piece from the CDC. Right now, I don't think we are seeing that issue in Kentucky, but we're still really early in our second doses. Finally, some good news for our country. While there was a lot of talk about rollouts in different states and different places, the majority of states have now issued over 90% of their vaccines they receive. Now, again, you got to look at this at the end of the week. We get all of our vaccines late on Monday, our new ready to go on Tuesday. So if you look on Tuesday morning, there's always going to be the biggest gap. It shows 80% or 83% utilized on overall on Tuesday. That's because we just received and haven't even had an hour of clinic time to give them out. The best times to really look on seeing are Monday after the noon update. You can get a real clear picture of what that 7 days is. So that just gives you an idea that when you get on to look at it, we'll make some variance because of how long people have had to give it out. We're also seeing that it's really important for people to be able to do these on Thursday, Friday, and Saturday. We don't want work to be an impediment. And so you may see a really big pickup on those days. Certainly, most of our regional centers are open on or during those days as a primary focus. All right. I think with that, we are ready to open it up to questions. We are going to, of course, have our update on new regional vaccination centers and the federal pharmacy program on Thursday. That's as long as everybody can get here with whatever ice we are facing. I can certainly walk over, so we'll be doing it. But the map that you will see is really exciting. The map for next week is really exciting. Multiple places to get it in and around every county or every area development district will have a number of different options. And so our website is going to be key to knowing those options. There may be in your area development district 5 different places that have vaccine. That's because there are 4 different major programs out there. From us, could be in a regional center, a hospital, or in a local health department. From the federal government, it could be in a pharmacy or being given to long-term care or senior living centers. So we'll make sure that everybody has that full list. We're actually preparing it all for public officials all around the state, from state representative to county judge to others, to make sure everybody gets an updated list each week where they can direct people where to go. Now, just because there are more places to go doesn't mean there's that much more vaccine. So it's going to be frustrating, but know that if we want more places in the community, you may be making 2 or 3 different calls, and there may not be an opening at any of them because of a lack of adequate supply to get people vaccinated as fast as they want. Please understand, that's not that the system isn't working. It's that there is not the supply there yet. We will get to everyone. Patience is really hard, but we're being tested, and I think we're going to get through this. And everything I'm seeing right now, the exception of our deaths remaining stubbornly high, is really positive. So let's continue to be positive as we work our way out of this pandemic. Want to go now, before we open it up to questions, to Adam Mather. He was going to give us an update on the long-term care program run by Walgreens and CVS, some good news there, and some additional steps that we're taking to reach some of those populations. Adam?
Thank you, Governor. Before I get started on that, I had the pleasure and privilege of volunteering for the vaccination clinic at Broadband Arena today. Worked with 2 wonderful ladies, and we were able to vaccinate about 70 people. A tremendous operation. I want to thank Louisville Metro Health Department for putting together such a wonderful operation and getting vaccines to our fellow Kentuckians. So thank you for that. Now, if I could get the long-term care facilities vaccine update slide put up for me, please. Perfect. Oh, I think that's the wrong one. It should say long-term care on the top of it. Sorry. There we go. So some real positive news to what the governor had spoken about. As you can see, CVS and Walgreens have done a phenomenal job in really ramping up vaccinations at the facilities. And so we've moved on 100% to second round clinics. You can see in CVS, their long-term care facilities, which everyone would consider nursing homes, is at 88% for second-round clinics, and the assisted livings are a little bit behind that, but there's quite a few more, and that's at 79%. Walgreens has done 100% of their long-term care facilities and are moving on to their third-round clinics, and they're about 28% complete with those. And then the assisted livings are about 90% complete. And some good news, given that we've moved so rapidly with this program, and we're one of the first states to initiate it, we've been able to do some kind of innovative things with Walgreens as a continued partner. And so if I could get that slide pulled up with the support for community living, that would be helpful. All right, perfect. So just kind of run through the numbers so everybody can understand this program out in the community. This is support for community living, and we're targeting in particular the residential centers, and they're typically 4 to 3 residents in each residential center. There are a total of 137 SCL residential providers within the Commonwealth, and 103 counties have at least one SCL residential location. So this affects the vast majority of the counties in Kentucky. And then there are a total of 3,524 SCL recipients that are offered residential services as their plan of care. To date, with the help of Walgreens and our local health departments and community leaders, we've been able to vaccinate almost a third of those individuals, 1,110 individuals. And over the next couple of weeks, these residential facilities will be reached out by Walgreens if they haven't already gotten vaccines. So within 2 weeks, they'll at least have appointments to get vaccines. So that's really wonderful. And we're very appreciative of Walgreens and their efforts. And then if we could move to the next slide. Oh, there we go. Currently, the current state, they've started on Friday, and they have actually moved into 36 counties already. So they're doing this at a rapid pace and have reached out to 160 residents. And they are curating their experience so it's easier for them to arrive at the pharmacy and be able to get their vaccine very quickly. So we're very appreciative of that program. And as we wrap that program up, we're currently working on an additional program with local health departments to reach out to our senior, elderly, lower income congregant living spaces. And so we'll be moving into that. So those larger elderly, lower income facilities will start being reached out by Walgreens and their local health departments in order to get clinics set up for them. And that really speaks to, I think, the equity piece that we're working so hard to try and address within the Commonwealth. And Governor, I want to thank you for your leadership. When I was at Broadband, everyone was very complimentary of all the things that that the administration has done. And so thank you very much. Turn it back over to you.
All right. Thank you to Adam. And now we will open it up. We got a number of journalists on the line. We'll start with Chad Hedrick from WKYT. I'm sorry we missed you last night. Are you there, Chad? This happens once in a while. I'm gonna ask. There you are. Good.
There we are. Wouldn't let me unmute. We love technology. Governor, I wanted to get your response to the report from the auditor's office, from the unemployment office today. What do you say to these findings, and specifically the portion about the more than 400,000 emails to the unemployment office that were left unread? How do you answer to those Kentuckians who for months have been waiting for some kind of response, and it seems like they were ignored?
Well, 400,000 unread emails is unacceptable, but that doesn't mean that there are 400,000 Kentuckians that didn't get through. Our numbers are much lower than that. And I've got Amy Cubbage here who will respond to how they prioritized, what they prioritized, which they believe got them to the most Kentuckians. To the rest of the audit, they were things that we have publicly responded to before, from lack of guidance early on in the Department of Labor to the work we did directly with them when they raised issues, to being in full compliance now and having the full blessing of the Department of Labor. I think that was the federal law piece mentioned. To the data breach, which we talked about. In fact, it became public because my office noticed it, called it, and said we were going to make sure that we let the entire public know about it. These are challenging times. And when you cut and cut and cut a safety net, like previous administration or previous General Assemblies did, you leave us 90-something people short. The budget almost cut in half, all the local offices closed, and an IT system that should have been replaced 10 years ago. And then all of a sudden you have the most filings ever on top of that. You're set for the perfect storm. But to go through a little more point by point, we have Amy here. But again, you see this is happening in every state across America, but it's not an acceptable excuse. People have needed our help. We've been able to help the vast majority of them. But anybody out there who still needs help that we haven't gotten to, that's our failure. Amy?
Thank you, Governor. With specific reference to the 400,000 emails, just so people understand how things happened, especially early in the pandemic. Obviously, people were struggling to get benefits. People needed their benefits, so they were looking for any outlet they could find in order to get their claim worked. So emails flood in daily, and even now from multiple channels and into as many as 10 to 20 different email inboxes, formerly at Education and Workforce Development and now at the Labor Cabinet, often not even at the Office of Unemployment. So while we want to be responsive to emails and to anyone who is reaching out for help, we have limited staff, so we had to make sure that we were working the claims in the most efficient way possible. So priority was placed on not working through an arbitrary email inbox where someone's claim could have been filed 2 weeks ago as opposed to 3 months ago. We decided to prioritize these by the date of filing. So that way the people who had been waiting the longest were worked first, and you didn't end up in a situation where someone who didn't have the time or the resources to send multiple emails gets ignored, even though their claim is just as old as someone else's. And then just to elaborate a little bit on what the governor was discussing about the comments about violations of federal law. This is something we've talked about quite a bit in the press conference and was discussed previously in relation to the unintentional overpayment issue you might remember from a few months ago. When the pandemic started, there were all of the new federal programs, as the auditor's report accurately reports, that were completely new and difficult. And with the flood of filings, the Office of Unemployment was in the situation of having to address these without the benefit of full federal guidance. As that guidance came in and more instruction from the U.S. Department of Labor came in, the Office of Unemployment took several corrective actions, and in fact, in May, started to turn things around, and by this fall, had gotten so much better that Department of Labor has lifted any corrective action and has deemed us in compliance with their programs. So this was a learning curve for every state for Office of Unemployment, and they have gone to great strides to work hand in hand with the U.S. Department of Labor to get us in the compliant situation we're in right now.
All right. Next, we've got Josh James from WUKY.
Thanks, Governor. Piggybacking on that last question, could you elaborate on the quote high-risk decisions that were reportedly made in the unemployment system and the suspension of some oversight controls? The report blames failures of leadership on all levels. Do you agree with that assessment? And could you respond to the Democratic proposal to overhaul the system unveiled today?
I haven't seen, I was out today. I haven't seen that plan, but certainly there is a failure here that goes all the way back to any year that this computer system wasn't replaced. It takes 2+ hours just to pull the numbers on claims, I learned today. And it takes almost the Rosetta Stone to figure out what the screen means. Any General Assembly or administration that cut the number of people over there deserves some blame. Certainly, there are things that I wish that we would have done better. I don't want to blame that on our folks working every day to get through claims. Now, I would say that it's someone else that is putting the label high risk on those decisions. I think you saw many states that were making similar decisions based on guidance at the time or unclear guidance from the federal government. When a new program is out there and the pandemic was entirely new and we're supposed to be processing claims on it, and we don't have the clarity that we need and or the guidelines that are put out entirely change, you see things like that. I think you have seen considerably less concern over fraud here in Kentucky. And that's because a whole lot of those claims were sitting in the numbers that for so many months were reported as real people that were out there, where now the people are getting these letters in their mailboxes that are obviously not theirs. We see how much fraud there is. Amy, do you have any addition? Okay. Kimberly Keegi from WSAZ. And Kimberly, if I mispronounced your last name, this is the first time, please correct me.
Hi, Governor. Kimberly Keegi here with WSAZ. No apology needed for the mispronunciation. It happens quite often. So I did want to ask you, as we're beginning to see those active COVID-19 case numbers decline, and it's been kind of a trend we've seen over the last several weeks, does this have anything to do in relationship with a decrease in testing, or are we still testing just as rigorously as we were? And is it a sign of the vaccination working in our communities? Thank you.
So on that point, we think that the testing in Kentucky is still in a generally good place. And what tells us that this is real is that the positivity rate continues to fall. Positivity rate is a leading indicator as opposed to number of cases, which are a lagging indicator. In other words, we get the positivity rate directly from labs that report in. So we get them pretty much, they go into the equation the moment that they happen. Cases go through a process with local health departments and reporting up to us. We have seen a significant drop in our positivity rates. Going back 3 weeks ago, on this day, January 19th, it was at 11.55%, and now it's at 7.66%. So this is a real decrease. I do not think the vaccinations are yet having an impact on the number of cases. I believe it's a combination between weather, but also people doing a much better job. We just see really good mask compliance right now and better distancing. And I wish I could tell you the formula that created that. But sadly, I think it's that we've lost so many people. Everybody now knows somebody. Now we are seeing an impact of vaccinations in our daily death report, which the percentage of deaths that are people in long-term care is decreasing significantly, oftentimes going from 2/3 to 1/3. Now that should be a leading indicator too. It tells you that all of our deaths should be on the decrease, but those most vulnerable are being protected even by just that first round of vaccinations. Sarah Ladd from the Courier-Journal.
Yes, thank you. Good afternoon. Jefferson County now has a case of the COVID-19 variant that originated in the UK. And has the state found any more cases around the state, and how are tracking efforts going on that? Thanks.
Let me check on that. It hasn't been reported to me. Our major labs that we use in the state are doing the genetic sequencing to look for it. When we originally found those first couple, the number of different amount of sequencing we were doing versus the return, the finding of the UK variant was a lot lower than what we've seen in other places. We'll check in to see if we've seen any others. They have not been reported to me. And just as an update for everybody who's watching, really two major variants that we see out there. The UK strain, which is believed to spread faster. That's why people are concerned that while numbers are going down now, they could potentially go back up. Because of the variant. I don't think that has to happen. I think wearing a mask and doing the other things is still pretty effective, even if it doesn't work as effectively as the current strain. Then there's the South African strain, which there is some worry out there about the efficacy of the vaccines. Listen, even if they cut down on the most serious of reactions, that's a big deal. That's a big deal. Even if it just gets down to the flu shot efficacy, that works in how we deal with the flu. So the variants make everybody nervous, but they don't change the game plan and what it's going to take to protect ourselves until we're out of this and what we do to get out of it in terms of vaccinations. Alex Akisto from the Lexington Herald Leader.
Hi, Governor. People in priority group 1C are intermittently getting access to a vaccine in some places around the state. Certain places like UK have announced that they plan to begin vaccinating larger swaths of that group this month. You mentioned the uptick in federal allocation of weekly doses starting next week. When is the state collectively planning to begin transitioning to 1C? And if you can't say when, what metrics will the state use in making that decision? And then secondly, because you mentioned the closure of the regional vaccination sites, in the event that the winter storm isn't as severe as it's predicted in some areas, like Covington isn't expected to get hit as hard as Lexington or Bowling Green, is there a potential that if the storm is a flop, that site would stay open? Thanks.
Thank you. The sites that we announced, the Kroger sites, are going to be closed on Thursday. We had to make the call with Kroger about their level of personnel. We're watching and hoping everything can be open on Friday. And if we don't make the call to reschedule people now, then it becomes a real concern as we get closer to Thursday. And right now we got to schedule the same Kroger workforce to be there a little longer on some other days to make up for it. Logistically, it's just something that we had to do. Not excited about it, but don't want anybody to get hurt on the way. And I will tell you, emergency management, which is not prone to exaggeration, is pretty concerned about this storm. Certainly as a winter storm, the most significant as described to me thus far. The move to 1C, you're right. We don't have a specific date on it right now. And groups right now, when they talk about we're going to be looking more at 1C, are really being driven by how many people from 1B they have coming in and what their confidence level is in being able to fill up those appointments. We'll be switching when we believe that any dose or could go unused, or that appointments won't be filled up at any given time. Now, what it may mean is that we also look at opening some types of centers, like regional centers, to 1C earlier than local health departments or other groups that can be more targeted and can reach out to people a little bit easier. So I think that we are getting close to 1C, but we want to make sure that we get through some more folks in the 70 and older age bracket specifically. Now, when we move to 1C, and remember, people can dip down into 1C if it's needed to make sure that 0 doses are wasted and we get vaccine into everybody's arm within the first week of having it. When we get down to 1C, it's a big group. We are going to ask where people can, where providers can, that they prioritize people, 60 to 70 at that point. We can try to do 2 things at once within that group to have the overall group available, but to really be making a push on that next major group that is most vulnerable. Tom Latek from Kentucky Today.
Good afternoon, Governor. Two questions. First of all, you mentioned Kentucky National Guard on standby. Can you give me a little more detail on who is activated and exactly what their status is? And also, just a few minutes ago, the Senate passed the historic horse racing bill, 22-15. Wonder if you had any comment on that.
I think it's good. Historic horse racing right now brings in about $15 million to the state, supports a whole lot of jobs out there, has kept an industry that Kentucky is known for healthy. I believe that people should be able to make choices about their entertainment dollars, and that's one area that they do. So I would sign that bill if it makes it to me, and I think it should make it to me. I've been 100% supportive the whole time, not being being wishy-washy. I think this is something that is critical for our state. What was his other? Oh, the Kentucky National Guard. We can get you specifics, but this is a normal. We put them on alert. They'll have a certain number of people at different staging facilities just in case that it's needed. Right now, we haven't had a major mobilization of any type. And from what we see of this one, it being serious, but not being like 2009, we don't expect any type of mobilization to be necessary like 2009. I think this is a routine response to this level of storm that we would do in any other circumstance. Melissa Patrick from Kentucky Health News.
Governor. So the K through 12 dashboard that monitors cases and quarantine numbers in schools has about 182 schools that have not reported any data, and 401 of them didn't report anything last week. Do these gaps in reporting reduce your faith in these numbers, and what can you do to get a better response?
They don't reduce first, let me start with all the schools doing it right, which is where I think we should start. We have schools working so hard to have a safe environment, and part of that is being transparent. And those schools that report at the end of every day and at the end of every week are living their values of being transparent, and we appreciate that. It's really disappointing schools that wouldn't, because what they do is they remove the real information that leads to a parent having the choice that they need. And this information is especially important as we're able to get our educators vaccinated. Hopefully we can get every single school district open to in-person in some way that takes into account things like ventilation and density and some other difficulties that some districts face. But it's highly disappointing that schools would not be reporting, and I would not feel safe with my children going to ones that do not. That would not give me confidence that those schools are doing everything it takes to battle COVID, because they're not doing everything it takes for public health and local health departments and others to know the situation in their schools. Right now, it's primarily been encouragement that we've used, and that's probably where it's going to be. But I think we should all be disappointed that there are schools that claim they can keep our children safe that won't show us the data that backs it up. Kristen Shanahan from WDRB.
Hi, Governor. Thank you. Going back to the audit and the emails, can you clarify what you meant when you said it doesn't mean 400,000 emails failed to get through? And will those emails be read? And then also, employers are getting fraudulent unemployment claims. Do you have any information on that?
So my statement was that because there are 400,000 emails doesn't mean there are 400,000 people, right? 400,000 separate individuals. What we see are people naturally wanting to get through in any way, feeling like they can't, sending 40 or 50 emails to 10 or 11 people. Now, that's a failure of the system too, of not having the resources or the system in place to be able to handle the largest demand of all time. It's also due to the system being set up in ways that were meant to make people quit, which isn't right. Our hope is that there will be a program that can get through all of those. But if it means taking 5 people off of the oldest claims that they are working right now, which means they are talking to people who have sent those emails, then you really got to worry about that, because the first email, maybe somebody who's been helped, the second email, maybe somebody who's already been declined, the third email, and then by the time you get to the 15th email, you may have wasted the first part of your day on people that don't need help. So it's just a challenging balance. There are no good answers, but our hope is that we can get through all of these emails in a way that does not take our people who are on the front lines, getting these people the benefits they need off of that really important work, or off of stops that have occurred that in people's claims as they've gone. For those that think your emails are in there and you haven't been helped, please go to the Labor Cabinet website, sign up for one of the appointments, talk to a person there. And it's not their fault, so please don't vent your frustration on them. But if you have sent these emails and still not been helped, please sign up for that appointment. I think we will have new numbers on Thursday. We expect them to be a lot lower either on Thursday or if it takes a little longer in the system, because we are detecting and denying these fraudulent claims. Many of them have sat for a while. Lots of people are getting letters of fraudulent claims right now. It doesn't mean that anything's being paid out. It's just kind of an automatic response of what the benefits would be if they could prove their identity, which they have not in those circumstances. We've been getting those calls too. And it means a couple things. It means that there are a lot less claims, valid claims out there than we thought or may have been reported earlier. But we also need to reassure people that just because you get that letter and we can give an example, doesn't mean that there's any issue that you're going to get dinged in your credit or that there's going to be a check that comes. Give me the email again. I'm going to have Amy come up to give the email that people can send.
Yeah, and just for a small bit more of context, the federal programs that were enacted for the pandemic have had historic levels of fraud targeted at them and nationwide. And it's something that U.S. Department of Labor has been very concerned about. That has had an uptick with the re-upping of the Pandemic Unemployment Assistance Program in December. So that is one reason why we think we're now seeing an extra flood of these fraudulent claims. So if you get one of these letters indicating that you have been approved for benefits, it's not an actual approval. It is, just as the governor said, a letter saying that if you fulfill all the requirements, this is the amount of benefit you would qualify for. In fact, I got one of those letters based on a fraudulent filing myself. Those are not being paid out. You can scan that and email that to uifraud@ky.gov. So we can clear that out of our system. And if you're an employer who gets a claim based on an employee who's just sitting next door, we're hearing that an HR department calls and said, 5 of my employees who are still here, I just got unemployment filings. It's the exact same issue. If you're an employer, you can both respond like you normally would for an employment claim and indicate it's a fraudulent claim, the employee is still employed, and send it to uifraud@ky.gov, and we'll take care of those.
Lee Searcy from WLEX.
Good afternoon, Governor. Again, I have another unemployment question, a couple for you. I'll keep it brief. Yesterday, we told you that a lot of people who had made scheduled phone appointments with the unemployment office about their claims were not getting return calls. What have you found out about that, if anything? And secondly, I talked to a lady today who was pleasantly surprised to get more than $3,000 deposited into her checking account this week from the Office of Unemployment. The only kicker is she hasn't been drawing unemployment, and she hasn't been drawing unemployment since 2019. So how does that happen, and how concerned are you that somebody who hasn't even been getting benefits all of a sudden has that much money in their checking account? Thank you.
First, on the virtual appointments, we actually took the ones that we had information about and contacted them. And the ones we were able to contact either said there was a misunderstanding, they actually didn't have an appointment, they were trying to get one, or they had simply missed their calls. So we wanted to ensure that there were no glitches in our system, that when people signed up, that those appointments were somehow not getting from the computer system to the people who make the calls, or that we had an employee who wasn't making the calls. So we think the system is fine. We do have a problem with people not taking the calls when they have made the appointments. So please, if you have made one of those appointments, please answer your phone when we call. We try 3 separate times, but then the employee has to move on to the next appointment. So please, if you've made an appointment, make yourself available. Now, with respect to the fraud, we believe that there are a few isolated instances of some of these fraudulent claims being paid. We've heard of a couple of paper checks as well as a few direct deposits. We're working on a mechanism for how you can return that money. So if you have been a victim of fraud and received the money, but in the vast majority of these claims, at least 99% of those, nothing is being paid at all. So for those few that do get paid, like the one you mentioned, we are trying to figure out how that evaded our identity detection. But for the most part, we feel that our identity verification system has put us in better stead than almost every single state where they have untold numbers of fraudulent claims actually being paid out.
Ryan Van Velzer from WFPL.
Thanks, Governor. How many doses of the state of vaccine is the state receiving each week from the federal government, and about how many vaccine appointments have been canceled ahead of the storm?
We're just getting the cancellations out for today. We will get you that number. It would be the number that's been allocated to those Kroger sites. Our hope is to get it in still in that 7-day period. And I'm pulling up for you the weekly numbers that we have received from the federal government so that I can, well, I had it right here. Do you have the update that we did just the other day? If you could put it up on the screen about our efficiency with vaccines. We are looking at this. We put that up yesterday. I had that in my notes. I used it to talk about how much the federal government was sending to us. The chart, yeah. Now the other one. All right, so what you can see is that over time, the amount of, these are first doses, we'll get you the number of second doses too, but the amount of first doses that come in, and certainly there were no first doses for the first a week or so, are there. The pop in week 2 was that full amount of Moderna. And then recently, here I've got some coming to me. Yeah, we're going to have one update on this chart. There was one number that was off on February the 9th when we had put it up. So this week we got 68,475 first doses. Last the week before, 64,975 first doses. The week before that, 56,175. That's been even. 53,800 week of January 11th, 53,700 the 5th. On the 29th, 60,625, 104,000 first doses on the 22nd. On the 15th, 38,025. Now, those were to both the state program and long-term care. They do not include the federal program for the VA and the DOD. They also don't include the pharmacy program, which is just about to kick off. And then we can get you the total doses. We'll have to break down, if you want them, the second doses by week. Again, we don't put that on the website because our goal there isn't primarily the speed. It's actually getting it to the person who had the first doses. Last question, John Charlton from WHAS 11. Do we have John? All right. Thank you, everybody. Thursday, again, looks like it's going to be really rough weather-wise. I want everybody to be careful. We didn't fight for 11 months to stay healthy in a pandemic, to get out when it's unsafe and hurt ourselves or lose loved ones on the roadway. So please watch the conditions. You have the ability to now to work or learn or even get healthcare appointments virtually more than ever before. And that means when it's not safe out, there's still ways to get done what you need done. Appreciate Rocky talking about all the exciting things going on in Kentucky. There is a bright future ahead of us. And on the unemployment front, again, this is what happens when we don't keep our safety nets healthy, but we endeavor every single day to do better. And aside from the emails, which is not acceptable, virtually everything else in that audit we've addressed and are back in good standing with the federal government. We've talked about them a number of times before today. I'm really proud of everybody out there and how you're doing right now. Our mask usage, our social distancing, you're doing a really good job. And if we can keep this up as cases go down, we're going to have more opportunity, but we're also going to get to the point where a lot of people are vaccinated while putting the fewest people in danger until we get there. So please keep it up. I know there have been a lot of times I've stood up here where I've had to say we need to do better, but you're doing a really good job. Keep going. We'll see everybody on Thursday at 4 p.m.